Our culture up in the North Country is really focused on coming together to get things done. We're all familiar with working together. In fact, that's what we do best in the North Country. We're a health and human services organization. We are focused on, really simply, making lives better. We provide quality clinical care, and then we will get into any type of programming that helps people stay well in the community. Housing, transportation, help with pharmacy, supported employment, care coordination. There's a lot of great people here. There's a lot of really talented, smart folks who want to do better. You know, they really put aside their individual goals so that we could rally to the challenge that the pandemic presented. It was something that went from being something we watched on national news to actually affecting and impacting our operations. And it was really scary and uncertain. I was really proud of how our workforce came together. People were more selfless than I've ever seen. And we were forced into not only different working environments, but also the way we treat people, not being able to be close to them. We thrive and we connect with people, build therapeutic relationships from face-to-face contact. So overnight, we had to go from high touch to high-tech high touch, and everybody really stepped up to the challenge. We saw more and more people come into care than we ever had before.
We see folks from all walks of life. We meet everybody where they're at. We try to figure out what we can best do to help that person get where they want to get. COVID had both a pretty significant impact on my job and not much of an impact. The Crisis Center remained open 24/7. We still saw people in person. We were the only facility doing that, so I kept coming to work. It's the job I signed up for, provide health care. 2020 demonstrated to me that Citizen Advocates was invested in the community, assessed needs in the community, really sort of stepped up and demonstrated that, they're trying to do what they say they're trying to do. We offer walk-in crisis assessments, support, detox services for people looking to get some help with substance use. There's 24/7 staff available. We've got nurses to help manage meds. We've got case managers, peer support, skill builders, clinicians, and everybody sort of works together to make sure that people get connected with resources as fast as possible. It is a massive part of the support this community receives, and if they don't, there aren't many other options. If you are interested in making a change and you don't have an option, that window's going to close.
I would describe addiction. It's something that just grabs your whole entire soul, like it devours it. And you feel like in the moment, there's no way that I can stop doing this. You don't know where to turn to either. You don't know where to go. You don't know what's gonna work. It's all really scary. I had a prescribed opiate addiction. So that's what brought me to the Crisis Center. Sobriety is work. It's tough work. It was really for my kids and for myself. I was really lucky. I do believe I was really lucky, and that is thanks to Citizen Advocates for training me, and getting me to where I needed to be. The Citizen Advocates assisted me with the job coach training. I have to have a routine to maintain my sobriety. Citizen Advocates assisted me through COVID-19 by offering, extra support. I'm very happy and thankful for that, because it's hard being a single mom. My work is very appreciated. I feel like somebody working here. It's giving me a little confidence day by day. I am most optimistic about where I'm gonna be able to go. I'm looking forward to more years of sobriety. And Citizen Advocates will be able to help me through that.
Helping contribute to our community's response was really something that we saw resonated with our workforce. Part of the antidote to the COVID frustration, agita, fatigue, was helping others. We're citizen advocates 5 years, 10 years down the road. I really hope that we're in a position to continue to serve more folks in the North Country. We're a whole healthcare provider. That's how we fashion ourselves. That's how we position ourselves. We want the community to see that. We want the community, when they're faced with a challenge, to think of citizen advocates as part of the solution.